Hello everyone, this is Dr. Drake with levelupshoulder.com, and today we're going to discuss the anatomy of the shoulder. So I brought in the model today to help us work through this. We're going to start superficial and then we're going to go deep inside the shoulder. So first we're going to start with the muscle that we feel on the outside of our shoulder called the deltoid. For better understanding, this is a right shoulder model. So what's not shown here is this big deltoid muscle. So it originates from the collarbone and around the acromion bone in the back, and it's a large, powerful muscle that envelops the outside of the shoulder and inserts down here on the humerus bone to allow elevation of the arm. Deep to the deltoid, what we'll see are these four rotator cuff muscles and tendons. So we've got one large muscle in the front of the shoulder blade, that's called the subscapularis. If we turn the model sideways, you can see that this bone is called the spine of the scapula. So we have the muscle above it called the supraspinatus and the muscle below it called the infraspinatus. And then down here is called the teres minor. So those are the four rotator cuff muscles. We're going to strip these muscles away one by one. And now we're going to look at the shoulder joint. The shoulder joint, what's invisible for you to see is there's something that goes around the shoulder joint called the capsule. That's invisible. And then the ball and the socket. And the blue kind of represents the articular cartilage, which is a smooth surface of the shoulder that becomes irregular when you have arthritis. The gray represents the labrum of the shoulder. The labrum is a structure that surrounds the socket 360 degrees and allows for stability of the shoulder. In the front here, you can see this white tendon that comes down the arm and attaches deep inside the socket. And that's called the biceps tendon, the long head of the biceps tendon. What we don't see in the model is another insertion point over here. And that's where the short head of the biceps tendon attaches. So let's talk about the bony anatomy very quickly. The arm bone is called the humerus. And we have these insertion points up here that are marked in blue. This is where the rotator cuff attaches. This is called the lesser tuberosity. This is called the greater tuberosity. So the lesser tuberosity houses the subscapularis tendon, which is one of the four rotator cuff tendons. And then the three areas back here, they act as the insertion point for the remainder of the rotator cuff tendons. The bony anatomy of the shoulder blade itself, it's a long, broad, flat bone. And that shoulder blade houses, once again, the four rotator cuff muscles. In the front, we have a finger-like projection here called the coracoid. That tip of the coracoid serves as insertion points for the conjoined tendon, the pectoralis minor, and the short head of the biceps. We have these strong ligaments that attach the coracoid to the clavicle, which are called the coracoclavicular ligaments, and then we have the coracoacromial ligament here. So coracoclavicular are these two, and the coracoacromial. So then let's look at the top of the shoulder. The top of the shoulder consists of the shoulder, or the collarbone, or the clavicle, which sits in the front. There's a joint also that lives up top on our shoulder called the acromioclavicular joint. So this flat piece is called the acromion. This is the clavicle, so the acromioclavicular joint. And then finally, in the very back of the shoulder is the spine of the scapula. So the shoulder blade, or the scapular body, this is the spine of the scapula, the acromion, the acromioclavicular joint, and the collarbone, or the clavicle. So that summarizes the basic anatomy of the shoulder. I hope that helps. Have a wonderful day.